just as several other products that we have in Takeda, Adzynma is a pure replacement. We are giving the patient what they are missing. So these cTTP patients have a congenital deficiency of ADAMTS13, and Adzynma is then a recombinant form of ADAMTS13, and we're just giving that back. Now, I don't want to jump ahead, but I still want to comment that before then Adzynma was available to patients. Now, at least in the US to begin with, the standard of care treatment was plasma for these patients. And plasma works to some extent. We believe that our study shows that Adzynma works better. And the reason for that is that you can only give so much plasma to patients. Normally then you can give maybe 10 or maximum around 15 milliliters per kilogram. So a normal person would then get maybe a liter of plasma, body weight 75, 80 kilos maybe. We know that our supplementation with Adzynma gives about 4 to 5 times higher exposure of this critical enzyme than ADAMTS13. On top of that, we believe that our study has shown that Adzynma has a very beneficial safety profile. So there are well-known problems with plasma. Most common is hypersensitivity or allergic reactions of some form. And in some cases, these can be very severe and actually limit the use of plasma in some patients. And the third thing I would like to mention is that plasma infusions can only happen in a hospital. Normally it takes 3-4 hours. And if you then need to come in to get your infusions every second week, or maybe more common, it's a significant burden. And if you compare to Adzynma, then it's a small volume, 10, maybe 20 milliliters given over a few minutes. That infusion could also potentially be done in a home setting if the treating physician so thinks. So it's a package. I think we're offering something here which is a package with better efficacy, a very good safety tolerability profile, and also convenience. And sometimes the convenience can be really, really important for patients.